Hi, everyone. I hope everyone is safe at home and following the guidelines to prevent the spread of COVID-19. One of the key issues of stopping the spread of COVID-19 is contact distancing, which means the person who has been, say, tested positive for the virus has to trace his or her contacts and inform them so the spread stops and other people are tested. Uh, Governor Gavin Newsom has partnered with UCLA and UCSF to bolster that process in our state. And the lead at UCLA is our own Dr. Alina Dorian, whom we all know as the principal of the Rose and Alex Pilibos School. She's joining me today to talk about this very vital aspect of stopping the spread of the coronavirus. Dr. Dorian, welcome.
Thank you. Thank you for having me.
So tell us a little bit about the whole process of contact tracing and why is it so critical in the spread, stopping the spread of the COVID-19?
So I think just sort of putting it into context, what we know, right? We know we don't have a vaccine. We know we don't have any of those normal things that we use to stop the spread of communicable diseases. So until we get to that point, there's a few things that we do in public health that are very, very important. They are in finding the case, right? So the case is the person who's positive, who tests positive, and isolate them. So we need to take them out of sort of, the circulation. And then we start following up with each and every contact that they've had. Because with COVID, we also know the spread is very, very virulent, right? It spreads very quickly. Mm-hmm. That's what we're having with this virus, is that trying to identify every single person that initial case has come into close contact with. And the way we're identifying close contact right now, because you can imagine you're sick and I come to you and I ask, who have you been around in the last, 3 days, 6 days, 10 days? It's very difficult to sort of trace back. But we're really looking at close contact. So somebody that you've been with for at least over 15 minutes in a close sort of less than 6 feet contact. So usually it's family members, coworkers. Sometimes, you're in an event of some sort where you shouldn't really be right now, but you have been in 3 or 4 people. You feel maybe that social distancing wasn't kept the way it should have been. So then the contact tracers, which is what this program is about, really creating these contact tracers, they then call each and every single one of these people that you identified, and they start asking them questions about how are they feeling, et cetera, to give them, information on what COVID is, what services are available to them. But most importantly, asking them to quarantine for 14 days, to self-quarantine. So basically pull themselves out of circulation, as well as within their house as much as they can to try to self-quarantine away from everybody else. We know that that's very difficult in many homes and circumstances. But really, that's the concept right now, because we do this. We've done this forever. Since public health was established, this is how public health has worked. Figure out who's the one person who starts, sort of the index case, and then how it's spreading and stop it. And really, that's the biggest tool we have right now, until such things as a vaccine, at some point comes, or, we know other sort of things that we can put into place. Social distancing, obviously washing our hands, the face masks, and then this contact tracing is really the arsenal that we have right now.
For our viewers who don't know, Dr. Dorian is an expert in public health, and she has played a significant role in advancing public health issues in Artsakh. And she continues to do that, as well as be the principal of our school. One of the key elements of this contact tracing is privacy. How do you address that issue?
Okay, so it's basically confidentiality, right? But it's confidentiality having to do with health records and health information. And this is what we do all the time, right? In everything that we do, we have HIPAA regulations. When we look at student records, we have FERPA regulations. I mean, so there are regulations that are put into place. Sorry, I'm probably one of the only people who has a landline. But I'm going to take this. The reason I have a landline until now, when they're some of the cable companies are doing it is because I'm a disaster worker. And I know that landlines are, when you have a 911, they're directly connected to a GPS.
Okay.
That's why as a disaster worker, I've been one that's always had a landline. Okay, going back. And then this is life, right? Zoom and work and real life and social distancing.
It's the new normal.
It is, and there's nothing to be ashamed of. This is
Yep.
the reality, but we just need to forge ahead and figure out what we're doing. So coming back to the idea of confidentiality, it's really, you know, again, the confidentiality is just based on health records and health information. There's nothing that's being asked of the individuals, both the contacts and the cases, that are not anything that we would ask anyway when we're trying to do any sort of public health or medical programming. The other thing that's really important for this contact tracing is for us to be able to actually map and to look at the trend of the virus, right? The only way we know what's happening is if we have data. So just let me come back for a second. Why did we push for so much testing, right? Because we cannot do anything unless we know who is sick, but also sort of the expansiveness of how many people are sick, right? We call that sort of that denominator, right? We need to know the total population that's sick so that when we look at statistics and we say, so many people are dying, how virulent is it, how difficult is it? It's hard to predict if we don't know what the total is, right? And so a lot of this contact tracing also helps us in establishing that total. It also helps us in making sure that, boy, are we testing enough, right? And we also know that people are getting sick or passing on the illness, I should say, when they're asymptomatic. That's our biggest sort of hurdle in all of this. When you're sick, you know you're sick, so you can, you know, keep your distance from people. But the way that this virus is spreading is that people are mostly spreading it when they're asymptomatic. And the only way to know that you're actually positive is to be tested when you're asymptomatic. So one of the things we're trying to do with this contact tracing is also increase testing of the contacts who still, they say, I'm fine, why should I stay home for 14 days? And we say, at least let's get you tested from the beginning so we know if you're positive or not. You may just be asymptomatic. And there's like a weird sort of twist to all of this, where people are saying even those contacts that are asymptomatic may have initially been actually the initial case.
Mm-hmm.
And so there's sort of this puzzle of trying to put it all together. You know, it's interesting because we knew a pandemic would happen. We've all talked about this. We've known it. It's happened before. Granted, it happens every, 100 years or whatever. But, you know, if you guys remember a few years ago, avian influenza, bird flu, was what we thought was going to be the pandemic, which, by the way, still could be at some point, right? Sort of thinking about it. Then H1N1 or swine flu, right? Sort of took that lead. All of these things exist in nature already. It's just a matter of when that animal host or that animal reservoir, somehow that virus shifts enough that once it transfers to a human, it just sort of, you know, takes a life of its own. And we're trying to stay ahead of it, but it's tough. You know, I teach in my classes that the only disease, right, humankind, that we're this smart and we're this amazing, the only disease we have ever eradicated. So we've only eradicated one disease from this planet, and that's smallpox. Mm-hmm. Right? Everything into it as humans, we've been able to get rid of one bugger only, smallpox. And if those of you that are old enough, you remember, I do, that's how old I am, have you know, a scar for my smallpox vaccine that I got. That's it. That's how behind we are as a human race in just sort of keeping up with the rest of Mother Nature. Mm-hmm. And it's important to put it into context and understand the reality of what's happening.
I'm glad you brought up that we knew that there was a pandemic, because I have been speaking to several people who are detractors of this whole process. They're like, it's a hoax, it's a, you know, government ploy, et cetera, et cetera. Can you please dispel that rumor? Because I feel like it's that mind frame that also is holding us back to reopening our society, back to business, because people aren't caring about it. And you know, all of a sudden, either they're catching it or spreading it. So can you please, you know, firmly talk about what this is about?
Unfortunately, you know, the biggest thing, unfortunately, that I'm seeing as a scientist, so, you know, I'm also the Associate Dean for Public Health Practice at the School of Fielding School of Public Health at UCLA. And what I'm seeing is in in the milieu, the environment that we're in, a detraction, a stepping away from scientific fact. People are not believing science, which is really an interesting backwards movement in many ways, right? So let's go back to this. Let's just say it was a government. How is it that every single government on this planet has conspired together for this to be such a big issue? This is real. And if anybody doesn't believe it, you know, that's a big problem, because you are going to be one of the issues that I may get sick. And I feel very, you know, people talk about civil liberties, opening up businesses. Well, I have civil liberties too, and you need to stay home so that I could live, right? And that's sort of this thing that everybody needs to understand. The other thing we have as Armenians is, oh, Hayenk, Chenki Vandanalu, you know, I work in Qarabakh, Kati Oriunenk, right? I mean, it's funny, but it's really a meme, right? It's really not that funny, because the reality is people are dying. God forbid, thank God, that you don't have someone in your family that's that sick or that dying where you need proof that it's really happening. But it's real. It's so real, and we're seeing it, and it's not going to get better. And it's great that everybody's protesting that they want the beaches open and whatever. There needs to be relaxing, because we do also have to learn how to live with it. It's staying. It's not going, by the way. But at the same time, we are not prepared. And if for somebody, which it is, the bottom line is $1 versus a person's life, to me, that's just a sad existence already, right? And so I don't want to preach and whatever. Those of you who know me know I am that person who will empower and fight for human rights and social justice and what I do. But the reality is, it's a life. We're not talking about numbers. And that's another thing. We're so desensitized to numbers, right? 1,000 people died. 50 people died yesterday in one day in LA County. 50 people. Okay, people, in my head, you know what I always do? I go back to things like, wow, that's X number of Piliboses. That's X number of Qarabaghs. That's X number. These are real. One person, that entire family's lost. Mm-hmm. Entire network is destroyed. All because you don't want to stay home. I mean, it's such a oxymoron. I don't know what the right word is. I'm not an English major, but like just really that idea. So coming back again, we can give you proof and you can decide, but in the end, you can decide for yourself. The problem is it's not that kind of a decision, because once you decide for yourself that you're putting the rest of us, including your entire family, in danger. Mm-hmm. And so really thinking about that.
And thank you for doing that. Talk a little bit about Governor Newsom's initiative of engaging UCLA and UCSF in this process. What is that project, and what is your role specifically as the lead at the UCLA, as the lead of the team?
So again, coming back to just the contact tracing as one of the biggest tools we have right now to try and stop the spread, especially with the opening up, right, the loosening up of our restrictions. Again, just coming back, the idea is once we're especially loosening it up, we want to stop these little pockets, right, of spreading so that they don't get, they don't overtake the system. That's another thing we need to talk about at some point. But so the governor decided that, knowing that we need a lot of contact tracers. So you can imagine if one person is sick and they came into contact with 25 people, for example, somebody or some people have to call all 25 of those people and spend a good 15 minutes to an hour in really understanding what has happened, where have they been, and then their contacts also need to be traced and sort of thinking about that. So it's a very labor-intense process, human labor-intense process. And, for many years, unfortunately, public health was, and the reason, by the way, public health was underfunded, so coming back, is because we live a great life. People are like, oh, Dr. Dorian, now there's a pandemic, public health. I'm like, no. For all the years that there wasn't a pandemic, that is public health strength. Mm-hmm. That's what public health does, right? So basically, because of that, because we've done such a great job, they've cut funding to public health. We're very underfunded in having, contact tracers, disease epidemiologists, disease investigators. So the idea is to bring in other, right now it's basically state and county employees, reorg them and have them retrained so that they can become contact tracers. We're hoping to train up to 20,000 people. And, you know, the other thing to think about is, yeah, it's 20,000, but some of these will then go back to their original job. So there'll be the cycling of having more and more people retrained. Right now, we're not training sort of community members or people that are outside of the state and local health jurisdiction sort of payroll or system because there are people that they want to reorg right now. But after they go through that process, they will probably open this up and have, again, community members, dental students, medical students, public health students, everybody who feels that they can actually provide enough time and effort into doing this, we would be retraining them too at some point. But right now, it's really sort of the state and county or local health jurisdictions that we're retraining to do this contact tracing. So we did our first training last week. It was a pilot, and it's a virtual training academy. And so there were 550 people who came through. We pilot tested it. On Monday, we're training 3,000 people.
Wow.
Imagine, yeah. And, you know, the training is a 20-hour training. It's not, you know, a short thing. There's a lot of one-on-one. There's a lot of breakout rooms and knowing how to do interviewing, motivational interviewing, rapport building, understanding cultures, understanding languages, you know, realizing there are a lot of people who feel uncomfortable to get a call from the government agency asking questions, right? Really, and just sort of understanding. And people need to know what services they can provide, right? What mental health services are out there? What food services out there? We have a lot of people that are food insecure, people that are experiencing homelessness. So how do we, or on the verge of experiencing homelessness? So these contact tracers have to know how to do all of that. And that's a lot. That's a lot on one human. It's also emotionally very taxing to listen to everyone's story and to help them in being able to just ultimately the message is please stay home for 14 days and we're going to help you do that. But it's not as easy as it sounds.
So let's say, for example, I test positive for COVID. How does your outfit come into my reality?
So once you test positive, that test result goes to your local health jurisdiction. So for us, it would go to LA County. But again, there's 58 local health jurisdictions, the state of California, and 3 cities. So actually Pasadena has its own completely outside of, and so does Long Beach, Berkeley, but for us. So if you're in Pasadena, it'll be a little different, but for everybody else, basically that information, that test result goes straight to LA County. So then LA County sends calls, basically, because we can't see each other, but originally they would send, right? We do this investigation, by the way, for TB, STIs, measles, any outbreaks. We do this normally, but they would call you, and that would be a case investigator, which is a little different than the contact tracer. The case investigator would run through with you, you know, what your results are, what you know, just sort of everything, asking you to make sure you're isolating. Can you isolate? What does your home look like? Do you only have 1 bathroom? Do you have, you know, everything? Just sort of thinking about how to empower you to be able to actually self-isolate. Meanwhile, in that interview, they're going to ask you, who did you come into contact with? And you have their information that we could reach out to. So it's usually, again, family members, friends that they've seen, or coworkers, because right now things are so limited and sort of that's that. But again, remember, that's going to open up. Schools might open, things might open. So thinking about that. And then that information is then passed on to a group of contact tracers. The contact tracers then start calling all of these contacts and then providing the information. Each one of these, a case investigator, a group of contact tracers, have a medical officer or medical liaison on their team. So right away they can ask questions. They could have that medical person actually talk to the case or the contact if need be. And then the other really important thing, which of course, as you guys know, I keep raising because I'm Armenian, is language capabilities, right? So I've been really working on making sure that they have Armenian language capabilities. The county does. The county, really takes Armenian very seriously as one of their top languages that they need to be prepared for. But you can imagine if you're going to call somebody, you need to be able to actually not only speak in their language, but actually understand culturally where they are, understand their community, so you know how to ask the questions, and again, how to truly support and empower that person.
Okay. But that doesn't prevent me, let's say, if I test positive, for me to take the initiative and calling the friends and colleagues and
No,
whatnot.
and actually, I feel that every person should, I mean, there's an ethical sort of responsibility. You're positive and you want to let, you know, your brother, your sister, whoever it is know that, oh my God, you know, I'm positive. Just be careful.
Mm-hmm.
You're going to get sick. I mean, I think this is important for everybody to know, but you need to monitor yourself, right? The other thing you need to do is you need to monitor yourself because you actually might be sick, asymptomatic, and therefore you could also spread it to everyone. So really, in the end, it's all of this. And in many ways, it's all on ethics. It's all on a code of honor, right? I mean, no one's going to come to your house and say, you're supposed to be self-quarantined. Why are you still at home? Or why did you go out jogging? Or why did, you know, whatever it is. So, I mean, a lot of this comes back to sort of that code of honor and your integrity and understanding the importance of following these recommendations. And then again, we're trying to build in, every local health jurisdiction will be different, but as we ramp up testing capacities, we want to be able to test the contacts, right? So that they know, are they positive? And then at the end of their sort of 14-day, test them one more time. Okay, you're negative, great. Like it makes you feel comfortable knowing we're not just sort of guessing based on not having symptoms.
And we're fortunate that, you know, Mayor Eric Garcetti a couple of weeks ago announced that every LA resident can go or get tested. And I have done so, and I'm waiting for my results, but it's a very simple process. You go to lacity.org and you click on the relevant buttons and you get a very quick appointment, and the testing is also very quick. They say 5 to 7 days. I'm on my 6th day. I'm waiting to hear. Hopefully I'll hear something today or tomorrow. But if you do have the time and the availability, I think everyone should go and get tested. Speaking of testing, Dr. Dorian, one thing that this entire pandemic tested is our education system. And I want you to, I mean, teachers were forced literally overnight to adapt from a classroom setting to teaching students online. Can you talk about how that process has been working at Pilibos?
Sure. So first of all, I literally want everybody to know, and I'm sure every parent who has a child at home knows, teachers are heroes. Like I can start literally crying right now. I get emotional because they did do that. You know, all of these people are trained to do face-to-face teaching. They're trained in a specific pedagogy. They have created hours and hours, if not years and years of resources of knowing how to deal with our students, understanding each student's learning style. I mean, just so much goes into teaching that I think people really, really underestimate. And then all of a sudden we say, tomorrow, guess what? You need to teach through a computer screen. They're not even Zoom savvy at that point, right? I mean, we were lucky. All of our teachers had been using technology. You know, we've all moved into that direction, but it's not the same, right? We've had Google Classroom. We've had, you know, all of those things ready to go. But creating bonds and truly having students learn via this platform is a whole other thing than just coming on and teaching, right? There's a big difference. Learning is what we want. Teaching doesn't really matter ultimately, right? And sort of thinking about the verb that we're looking at. So all of our teachers really quickly transitioned, especially our core classes. That's how we started, you know, in being able to provide instruction. But I think some of the things people need to understand is, first of all, the school is open. You know, our schools are closed. No, UCLA is open. I'm teaching. There's still services. Everything is happening. Pilibos is open. But we had to switch to a different platform and a different understanding. We also have to realize that there's sort of asynchronous teaching and synchronous teaching, right? Asynchronous is everything you would do offline, which we used to do at night when you came home and you did homework, for example. And synchronous was your live sessions. And so right now, really thinking about remote learning, which we've been on the fly learning remote pedagogy and what that looks like. It's looking at that holistic experience of both synchronous and asynchronous teaching, right? And we used to rely on 8 hours of synchronous. We can't do that now. Like we can't do that for many reasons, first of all. And I want to step back to priorities, right? number one priority is mental wellness, right? And just like social emotional wellness. We're getting a little bit better at it because this dragged out long enough that everyone started finding a groove. But in the beginning, it was just sort of everything was upside down. You know, people would say, Dr. Dorian, are you having a good day? And I'd say, I don't know, it depends on the hour, right? I would have a great hour and then I'd get a sucker punch in my stomach the next hour, and just sort of figuring it out, understanding who I was, how I was going to function. I'm a printer person, paper person. I was like, oh my goodness, how is that going to happen, right? So I think we realized that everybody, not just the students, but parents and teachers are victims in the sense that we're all going through this. It's not like the teachers were just sitting at home pretty and, you know, they have their families that are going through all of this. Their kids are at home, right? And so, you know, really, really stepping back to what's important, and what's important is our love for one another. What's important is our respect for one another, really, and trying to find the right way, individualized, how to move forward, right? There were kids in the beginning who couldn't even log on. There were kids who their grandparents were watching them for X amount, they couldn't do it. There were kids who didn't have computers. There were teachers who didn't have laptops because they didn't have the preparation, you know, they had the school that they were using. So there's a lot of equity issues. There's a lot of inclusion. I mean, just this morning, by the way, my Wi-Fi went out and I had to do this Zoom, and I thought, I mean, it's just perfect timing, right? So, you know, I mean, keeping all of that in check, I think that our teachers, I know they've done a phenomenal job. And we've tried to instill as much rigor as we can, as necessary, but as time moved on, right? You can't demand when you can't know what somebody is going through at home.
Mm-hmm.
So at UCLA, we always talk about this issue that safer at home is not necessarily safer for everybody at home. And I don't necessarily mean physically or emotionally, but just in every way. There are a lot of people that don't have a specific place that they can close. I mean, some of you might have heard my door opening and closing. So, you know, it's that it is what it is, right? And so trying to find that space and that time, and that, you know, parents are very emotional. People are losing their jobs. There's furloughing. There's just so much happening. And in the middle of that, we're just trying to keep Pilibos giving the best that it can to its students, both in academically as well as emotionally. You know, we've always been sort of the constant in these students' lives. And that's what we've just tried to be again, that constant in students' lives, that constant Armenian academic home, basically, for them. Mm-hmm. And so they've done a phenomenal job. And I will say, you know, every day they do something that I'm just like, wow, this is amazing, right? And, you know, we try to keep giving professional development in the middle of all that. And just, again, meeting the needs of our students. Mm-hmm. It's been interesting. And I will tell you, our students, that's the other thing. We started with an amazing crop of students, right? We had the ability to really, really build those bonds and love each one of them, where in this moment, they still feel that. Mm-hmm. And I think that's really important.
I think one of the key things that you mentioned, and I think everyone should really understand, that schools aren't closed. In fact, they're open. The physical building might not be functioning to its full capacity, but school is functioning. And in my reporting the past couple of weeks, I have heard so many positive things about Pilibos, about Ferahian, about Shamlian, the schools that are operating by under the Board of Regents of the Prelacy Armenian Schools. And it does make me proud that both our teachers and parents and students have been able in a short time to kind of recalibrate their reality and conform to the current situation that we're living in. I also heard that the school surprised all Pilibos 2020 graduates by putting a big sign in front of their houses that was very touching and moving. What's going to happen with graduation?
So you made me cry again. Everybody knows I'm a baby. So let me just also, I want a big, big, big shout out to our parents. Our parents have stuck with the mission of just education in general, but the mission of an Armenian education. And they have been the staunchest partners we could have ever asked for. So I really, really want to thank them, and I'm humbled with the amount of just effort that they've put into all of this. So this year, senior 2020, you know, it's funny, a lot of them, by the way, were born during 9/11. So I always call that out and say, gosh, you guys are the ones that shake up this world all the time. You know, it's in many ways a rough reality for them because they didn't have the moment of closure. We didn't know if we were going to come back. And so when we sent everyone home, it was like, let's give it 2 weeks. Let's wait after spring break. And so they never had that time. And so many of them called that out and said, you know, Dr. Dorian, we didn't have that last moment where we stood in the hallway and said, oh my God, this is the last time we'll be in this hallway or use my locker. And I didn't have that last moment to hug and kiss them, which I always say COVID's going to drive me crazy because post-COVID, I'm a big huggy, kissy principal. And so I got to figure out how I'm going to do that. But what we decided, you know, as we're going through this, constantly thinking about how to remind them how important they are to Pilibos, but really to the Armenian race. You know, ultimately, in the end, our mission is to be the best academic institution we can be in order to create the best leaders of our race, right? That's really ultimately it. Pilibos is a conduit to that. And so we've tried to do a lot of things here and there. You know, it's difficult, but one of the things we really wanted to do was just have a surprise where they could come out and sort of see, we put the signs telling them that we love them and that they're senior class. And admin did that. So that was another interesting thing. So all of us divided up the map and got into our cars and went one by one. And some of the kids saw us and some, you know, it was just a phenomenal experience. And I wish we could do more for them. They also will probably have a difficult time because their fall quarters for most of them going into college will end up being remote. So it's an interesting time. So coming back to graduations, the reality is we most probably cannot hold a graduation. I mean, I always say most probably because I'm always that person with hope, even though I'm so in the system and I realize I just don't know how that's going to happen. You know, the universities have all called off their graduations. They're all virtual. It's interesting to think about what a virtual graduation can look like. We just did our National Honor Ceremony via Zoom. I mean, it was great, but it's not the same, obviously. So we've been thinking about different things and what we can do. We've come up with a few ideas that might be able to happen with some social distancing. Whatever it is, it will not be what it would have been pre-COVID. That way, it won't be the traditional, 600 people in the Pilibos gym walking through with all of the, faculty and administration in their regalia, and then our kids in their regalia. Unfortunately, it won't be that. But, we will try to make it as special as possible. And in some ways, this will be hopefully a gift that they will take from this point forward in their lives as this unique group of students. I don't know. I love them, and we're going to do our best to figure it out.
I always say they'll have a good story to tell their children and their grandchildren about their high school experience.
And that thing where they have that, where grandparents always say, oh, I walked so much in the snow. They really can say, really? I was graduated in a pandemic.
Yeah. Well, hopefully this pandemic will start slowing down and we will be able to resume some semblance of normalcy. I know that University of California has announced that the fall quarter will be virtual. Any plans at Pilibos or the other Armenian schools about the fall?
So we're working together, obviously all the principals and the Board of Regents, and just sort of talking about it. We are all creating kind of contingency plans, but the reality is, unfortunately, or as we all know, every week is a different picture, right? Every 2 weeks it's something else, from the testing capacities to what the recommendations are for infection control, right? What is infection control 101? I think, our biggest issues with the schools, and that's why the Cal States, and I'm pretty sure the UCs will be moving in that direction on the task force, thinking about what would hybrid learning look like and who could we let on campus. But I think one of the things to think about is that, ultimately you cannot have 700 people in that building at the same time. So what will that look like, right? Still somehow keep the 6-foot distances, whether it's in the classrooms, but we also have to not have intermingling between cohorts, right? Because that's increasing contact. So, you'd keep a class together, they need to just move together, and then they can't move with other classes. So, I mean, there's a lot of planning that would have to happen. And I think if we were to physically come back. So I think the reality is that we're trying to find sort of, again, a hybrid model. Nothing is set, nothing, we don't know. But really figuring out, health and safety is number one. So, and it's health and safety of our students, who, by the way, even though a lot of people are like, oh, well, the children aren't getting sick, they're all getting sick.
Mm-hmm.
They're not, either being totally symptomatic or getting very sick, but they still move the virus around. So they can actually distribute it to the teachers, the administrators, but also parents and family, right? And sort of thinking about that. We also have to think about just the well-being of teachers and students and teachers that are either immunocompromised or have other risk factors. I mean, there's a lot that goes into this planning. So are we going to be completely pre-COVID normal? There's no. I mean, that's definitely a reality. That one I know for sure. But what the model will look like, what kind of hybrid remote, we're working on it. And probably, honest to God, we won't know until we get to August. So we have scenarios, but in August, we'll see what makes the most sense in the sense of safety for everybody. Because the other thing to keep in mind is, should we have a case, and then that case creates 2 or 3 other cases, they will shut down the physical structure, right? And so we need to also think about sort of, then what's the contingency for that at that moment in time? So there's a lot of factors that comes into the planning. Do we want to open and physically be together? Absolutely. I mean, that's what we know, that's what we love. But unfortunately, it's a new reality, and we're going to do our best to figure out what works for all of us.
The best of luck to you. There are several variables at work in all of us resuming what we want, and a kind of a normal reality. Thank you so much for everything you're doing at the school and this new challenge that you have. I think you've brought up a lot of very important issues today about the critical aspect of preventing COVID-19. So I'm asking our viewers to, when you view it, please share it with those who might not be on the Aspar's site or on the social media, because she did have very important information to pass on how all of us have to play a role in ending or preventing the spread of this virus. Thank you, Dr. Dorian, and good luck.
Thank you so much, Arajan.
Have a good day.
Thank you, you too.